Hello, my name is Dr. Justin McCormick. For the last 10 years, we have been specializing in the diagnosis and treatment of chronic pain patients, patients with chronic fatigue, and patients with fibromyalgia. We've successfully treated anywhere from 45,000 to 50,000 different cases in this office. Now, we use a specialized technology, and we call that brain-based therapy. We're going to talk about that in a little bit. We use that in conjunction with other specialized technology, things like spinal decompression, laser therapy, oxygen concentrators that all help the patient heal as quickly as possible. Our success is very high, and the reason it's very high is we've been able to find the underlying cause of these chronic pain disorders, not just cover them with more and more medications. First of all, what is fibromyalgia? Many people come in thinking that they have a muscle problem or maybe a joint problem. The reality is it's actually a neurological problem, and we're going to talk about that in a moment. So there's three things that I want to talk about with fibromyalgia. We call them the 3 R's. First, we know it's real. People are not faking it. We know this is a very real condition. 2, it's reversible. We know that through proper treatment and diagnosis that these problems will get better and people can get their life back. And 3, it is not reversible by just giving them more drugs. Now, what is fibromyalgia? Again, I said it was a neurological problem, and we found that it comes from a misfiring of the brain, but that has to start with something. That start is typically some sort of serious stress, whether that stress is emotional, physical, or traumatic. Some stress is released into the body. That stress releases a substance that we call cortisol. You may have heard of cortisol. Cortisol is toxic to the brain, and when it gets into the brain cannot function properly. So it starts misfiring. There's 3 parts of the brain I want to talk about. We call these the pons, the medulla, and the mesencephalon. The mesencephalon is the most important part of the misconnection between fibromyalgia and chronic pain. There's an area in the back of the brain, and we call that, like I said, the brain stem. It's right back here, and the mesencephalon is the uppermost portion of that. When that cortisol starts traumatizing and being traumatic, toxic to the brain stem, it starts firing out of control. The most common thing that we see when that happens is pain. Pain comes because that cortisol, as it kills out the mesencephalon, starts causing it to release substances in the body. That substance we call is nociceptors. Nociceptors can be anywhere in the body. So with a fibromyalgia patient, they may have pain in the shoulders one day, pain in the back the next. They may have hip pain the next day. Again, it's just all over the body where that pain can be. We also see insomnia. They can't sleep because, again, when that area of the brain, the mesencephalon, is overfiring, when that person is trying to rest, it's still going a mile an hour and it cannot heal. We also see pupillary dilation. In other words, they're very light sensitive. The pupillaries can't constrict, and what that does is it keeps opening up and the person may be very light sensitive. Migraine headaches, another very common thing, because the vessels in the brain, the blood vessels, constrict, and that may form a chronic, constant pounding migraine headache. They also may have their heart racing. Okay, again, when that brainstem is overfiring, it's going into the heart and it's just beating, as fast as it possibly can. That could cause a lot of heart palpitations. We also see, again, joint pain. It could be anywhere where those nerves are in the body that the person has very intense pain. Now, why do most treatments not work for fibromyalgia? The most common treatment is drugs and more drugs. That may be okay for the acute patient who has very big flare-ups where it may calm down some of those flare-ups so the body can heal. But it's not going to correct the underlying cause. It's just going to cover it and allow it to get worse. The thing that we do different here is we find that underlying cause. Okay, we do that through, again, the diagnosis, finding where the brain is not firing properly, and then through a proper treatment plan. Now, what treatment do we do here? Okay, one of the things that we specialize is, again, with the brain-based therapy, what we want to do is find out, where does that person's body need to be stimulated? So we may go down through the spine with an instrument we call an activator, looking for different areas the nerve isn't working properly. It's very light, it's very gentle. Most people don't even feel much at all. But as it releases that pressure, it goes up into the brain to tell it how to work properly. Now your brain needs two things to work properly: fuel and activation. Where do we get the fuel from? Glucose and oxygen. So part of what we're going to do is make sure that that chronic pain patient, fibromyalgia patient, is going to be on a proper diet. We need to get that under control. The other thing for the fuel that they need is oxygen. So we use what we call oxygen concentrators. It puts 90 to 95% pure oxygen into the body, which the brain is highly dependent on so that it can work properly. Now, as I said, it also needs activation. So we're going to work on those areas of the nerve that need to be activated so your brain can work properly. We use treatment called DRX 9000, specialized spinal decompression machines that open up that nerve to allow it to function properly and get your brain to start working as it should. Supplementation is a big part of what we do. L-tryptophan allows serotonin to work properly in the brain so your body can heal properly, calm down that brainstem from misfiring, as I said. We use fish oils, omega-3 fatty acids, that help the nerve in the brain to heal properly. We use laser therapy. Lasers are amazing technology. Photons go into the body, and what it does is enables the body to heal as it should. We use that in conjunction with many other different therapies. But again, that's some ideas of what we do here. Now, I'm sure that you would like to know if you do qualify and if you can get your life back through this brain-based therapy that we do here. If you are interested and you would like to find out if you qualify, call our office for a free consultation. We'll find out first if you do qualify. Second, we'll go through a proper treatment plan on how you can get your life back. I'm sure many of you, if not all of you, want to know, how is this cost? How much does this cost? And how does insurance work? These are great questions, and we'll help you through this, but that does take a lot of time. So first, let's just find out if you're a candidate, if you qualify. We'll do that at our expense, and before we go any further, we'll make sure that we find out all of the expenses, all of the insurance information. We'll do the very best we can to get your life back. So again, call that number on your screen. It's a free consultation with me or one of our other doctors. We'll do our very best to get your life back. Thank you, and we look forward to hearing from you soon.